Double-click on the IMR icon from the desktop screen. Enter your username and password into the login screen and click Log On. Double-click on the FirstNet icon, enter your username and password, press Enter or click OK. If you are unable to log into FirstNet initially, whilst you're in PowerChart, click on My Experience User Console button from the top toolbar. This can be hidden under your drop-down arrows. Your position will show as R3 Registered Nurse. Select R3 Nurse Emergency and click Save. You will be prompted to log out. Once you are logged into FirstNet, to view the floor plan, select ED Floor Plan from the top toolbar. Select the appropriate area you wish to view using the drop-down arrow from the first window. This will show an overview of the floor area. When you click on a bed location, you're able to see the patient information as shown on the tracking board. The ED Tracking List. The ED Tracking List is the default screen after logging into FirstNet. The ED Tracking screen shows the list of patients in the department and their demographics. The first time that you access the ED Tracking List, it will show all the patients in the department, including any pre-arrivals. You should narrow it down to your assigned working area by using the tabs across the top. There is a lot of information displayed on the tracking list, most of which is easy to figure out and better learnt on the floor. If you hover your mouse over any of the various icons, you will be given a brief description of what each icon means. The NR column displays the nurse assigned to the patient. Other important icons on the tracking screen are the Open Patient Chart icon, Add Order icon, Document Interactive View, and Managing Deterioration icon. The Patient Summary icon tells you what has been done for the patient and what is still pending, and the Depart Process icon will be used when the doctor is ready to discharge the patient. Checking in. The first thing that you do at the beginning of your shift is to check into FirstNet. This is done by using the check-in icon in the top toolbar. In the Display Name text box, enter your first name and last initial. In the provider role, assign yourself as a nurse. Select the appropriate default relationship from the drop-down box, e.g. Registered Nurse. Click the Assign button repeatedly until all available teams move from left Available Teams box to the right Assign Teams box. Ensure the Available Provider box is ticked and click OK. Once you have checked in, you're able to assign yourself to a patient. You can do this by using the Assign Provider button in the icon toolbar or by right-clicking on the patient's name. Completing the initial ED assessment. Double-click on the clipboard icon located in your Patient Activities column. Put a tick in the box next to ED Assessment Adult. Click Documents to complete. Complete initial clinical handover and primary assessment fields as a minimum. Documentation should include a brief summary of the clinical findings from the first nursing assessment conducted on the patient after receiving a handover. To complete, click the green tick icon located in the top left-hand corner to sign. Opening the patient's chart. First, ensure you have the correct person highlighted from the tracking screen. There are 3 ways to confirm this. The patient's name will display in the patient box on the tracking screen. Their line will be highlighted grey, and their name will be in the top right-hand corner of the banner bar. There are 3 ways to open the patient's chart. One is by double-clicking on the blue triangle in the far left-hand side of the tracking screen. 2 is by clicking the patient chart icon, or by clicking the patient's name. Documenting your patient encounter. To document your notes, click on the documentation icon from the ED tracking screen. It's a red clipboard. Once the patient's chart opens up, click the +Add button. You must select the type of document you wish to create. Progress Notes Emergency is most suitable whilst working in ED. The template that you choose will be a progress note blank. Complete your documentation, and once finished, ensure that you sign and submit your notes. Ensure that you correctly title the document. The naming convention within TTH is by team, role, reason. An example of this would be ED nursing, the location you worked, and then the shift you worked. All additional notes by any nursing staff for that patient for that shift should be added using an addendum feature on the original document. Addendums can be added at any time by navigating to the Documentation tab and double-clicking on the signed nursing document you wish to add additional notes to. You are also able to modify an existing document to add your addendum. Type your additional notes in and sign when complete. The RAT/RERAT must be documented as a separate standalone clinical document within the patient's IEMR. No progress notes are to be included within the RAT/RERAT document. The RAT/RERAT document should include the following details. If it is the first RAT/RERAT entry in the patient's IEMR for the current encounter, then a new progress note must be commenced with the following title: ED RAT/RERAT, and then the shift. The same note is to be used to document any further RAT/RERAT requests during the shift by using the addendum process as outlined previously. If the patient remains in ED or SSU across multiple shifts, then each shift requires a separate RAT/RERAT progress note. To add a set of vital signs, make sure your patient is selected on the ED tracking board and click the Interactive View icon button. Once the patient chart opens in Interactive View, double-click the dark blue box under the relevant time column and enter the vitals. Once complete, use the green tick icon to sign off. PIVC insertion is also completed in Interactive View in the ED resuscitation band. To create a line, you must first select Peripheral IV, then click the dynamic group icon and set the line parameters. Double-click on the dark blue box to activate the column and enter any relevant details. Click the green tick button to sign when complete. Specimen collection uses positive patient identification checks and scanning to record collection and print labels in FirstNet. The specimen collection window can be launched within a patient's chart or from the ED tracking list. The specimen collection button appears in the IEMR top toolbar. To collect a specimen for the patient, highlight them on the tracking board. Click the specimen collection button from the top toolbar. The collection details window will open. Confirm your patient's identity. Scan your patient's wristband by using the barcode scanner, or if that's not available, click on Unable to Scan Barcode. The collection details window will open and display the list of orders required for collection. To print the label for the specimen, right-click or use the downward arrow towards the right-hand side of the screen. Select the specimen labels required for printing. Select the printer from the drop-down list or scan the square barcode on the printer and click Print. The labels will print to the selected printer. Once the specimens are in their containers, initial, time and date the labels and affix them to the appropriate container. The barcode must be horizontal and straight and over the existing tube label. Use the barcode scanner to scan the labels attached to the specimen containers. The system will confirm that the patient chart that's open and the specimen container match and are correct. The specimen order will be displayed with a tick beside it to indicate it's collected. If a barcode scanner is not available, it will be necessary to manually change the collected status from the specimen collection window. You do this by hovering your mouse over the specimen that has been collected and doing a right click, or again by using the drop-down arrow to the far right and indicating collected. Once you have indicated all your collections have been collected, click the Sign button down the bottom right-hand corner of the window and then close. Discharge process. Most often, a doctor will complete the patient discharge within FirstNet. However, it can also be completed by the nursing staff if required. Select your patient on the tracking screen and then click the Depart Process icon. Yellow menu items are mandatory fields that require completion. The doctor will complete the working diagnosis mandatory field and complete their discharge letter if required. The departure ready time needs to be completed as soon as the patient is ready for discharge, along with the evaluating impact of alcohol in D presentation field. If the patient is being admitted to the hospital or short stay, the working diagnosis, depart ready time, ED departure, and evaluating impact on alcohol tabs still need to be completed.